Good day, my beautiful people, and welcome back to the Gray and J family.
If you're new here, please mash up that subscribe button down below.
And don't forget to hit that notification bell because we post 2 videos every single week.
Trying to,
yes.
Alright, for those who are new, my name is Jayan and this is my significant other, soon to be husband, Grayson.
Hello.
And we make up the channel Gray and J Family. In today's video, we will be discussing our plans in terms of trying to get pregnant during this pandemic. In the state of Florida, today is the official start back day for businesses to be open, that they could see patients, do stuff, etc. And that is also including my fertility specialist.
We have a video.
It's from Zoom, so the app Zoom.
It's literally just a video interview.
Yeah. So we didn't have to leave the comfort of our own
It was a conference.
Yeah.
So it's literally a video conference that we're gonna talk to our new fertility doctor with.
Yeah, because we weren't too pleased with our past fertility specialist doctor, so we asked to switch doctors. Hopefully we will be able to post or include the video with our appointment as much as we could share with you guys. But just giving you guys a quick update, I am currently on cycle day 49. No period. We are now going to make plans to try to get pregnant, and I did a pregnancy test just yesterday and it showed negative. So it's all me.
Yep.
It's all me and my hostile uterus.
Just so you guys know, some of the stuff that's discussed in today's video is a little more on the descriptive side.
Yeah.
So if you're...
It's a lot of TMI.
So just a heads up. But other than that, we'll see you after the interview, guys.
Yep.
Alrighty.
See you soon.
Alright. Bye.
So let me just ask to start with, what do we want to address today?
All right. So we were trying to get pregnant last year. It was unsuccessful. We took 2 rounds of letrozole and both of them were no success. Right now, my period for this year, my cycle has been later and later and later, and I am right now, I was expecting my period since last week or this sometime this week. I still have yet to have a period. I'm on cycle day 49 and my pregnancy tests show up negative. I did a pregnancy test up to yesterday and it still showed negative. Well, I'm 35 this year and we were contemplating in terms of when is the best time to try and get pregnant, and so I just wanted to see if we could start trying from from after this cycle when I get my period, because I mean time is not my friend and I just wanted to see if there's anything.
You're exactly right about that. And so yeah, you actually made this appointment exactly at the right time, because literally just yesterday or thereabouts,
Yes.
We got the go-ahead to start treatments again.
Yes, and I know that as well.
If you called me last week, I would have said, well, there's nothing I can do yet.
Right.
But now we're back open. We can start doing things.
Right.
So when I'm reviewing your records and with your history, you just told me, we've got 2 problems. One are the recurrent miscarriages that you've had.
Right.
So you've had 2 miscarriages, and the workup that you had for that showed that you've got a correctable problem called an antiphospholipid antibody. So as soon as we know you are pregnant, we need to put you on an injectable blood thinner twice a day. Okay?
Oh, okay.
And even starting now, I want you to start taking a baby aspirin every day and continue it through your whole pregnancy.
And I have been doing that for the past month. I've been taking prenatals and 1 low dose aspirin and 1 tablet of folic acid, and I've been doing that consistently every day, every morning after I eat, for the past month.
Okay, that's great. And then the second problem is what you were just alluding to, is you're not ovulating very often. And so we need to use these drugs to see if we can get you to ovulate better. Now,
right.
on that dose of 7.5 milligrams, I noticed your progesterone was a little bit elevated. It was 4.3. But we actually want to see it up around 14 or 15. So what I'm going to suggest is that we sort of eliminate this timing question and do a slightly different protocol with this. When your next period starts, I want you to call us up so we can get you in here to do that baseline ultrasound. And then we're going to start. So what I'm going to propose is that we still use the 7.5 milligram dose of letrozole for 5 days. But what we're going to do significantly different is we're going to schedule you to come back for what we call a mid-cycle ultrasound. Sometime around day 13, 14, 15. Looking for is on the ultrasound when you have a follicle that contains the egg that measures 20 millimeters. That means that egg is mature. And we're going to tell you, as soon as we see that, we're going to tell you to take an injection of what we call the trigger shot. It contains the hormone HCG. And that trigger shot will definitely make you ovulate 2 days later. Okay? So we will know the day you are ovulating. And then 7 days after that day, we're going to check that progesterone. And that progesterone should be, definitely above 10, hopefully above 14 or 15. And the combination of the stimulation of the letrozole with the stimulation of this HCG trigger shot, it is going to give us the best chance to make you ovulate normally. Now, if we can't get you to respond on that combination, then the next step of therapy is a really, really big step. And we'll talk more about that if we have to. But that's what I want to plan to do this upcoming cycle. So baseline ultrasound when your period starts, letrozole 7.5 milligrams for 5 days, ultrasound sometime around day 14, and then we'll tell you when to take that HCG trigger and get a progesterone 7 days after ovulation. I want y'all to understand is that even when you not ovulate completely normally, you only have about a 15% chance of getting pregnant that month. That is a normal chance of getting pregnant for any couple. And so what we're trying to do is just to make you normal, okay? And so if you take 100 couples, tell everybody, try to get pregnant this month, only 15 out of 100 are going to get pregnant this month. So don't get disappointed and don't throw in the towel, if you don't get pregnant. We first got to get you ovulating normally, and we haven't managed to do that yet. But I'm hoping this new protocol can get you to ovulate normally.
Well, I like this game plan. I appreciate you listening to me and addressing all my concerns. It's a breath of fresh air, to be honest.
All right. Well, we will see you hopefully within a few days.
All right.
Yay.
Thank you, sir.
All right. Well, have a good weekend.
Do the same.
Alright guys, so you guys heard our plans and with our doctor what we are planning to do. Hopefully this cycle, once my periods finally decides to come, let's hope for the weekend. Once it finally decides to come, we have a game plan, we have a strategy, and it's just to put it into play. Woo! Go team!
Woo!
The purpose of this and including this into our channel is so that you could follow us on our journey and we can tell you guys and give you guys updates on our progress. So thank you so much for watching. Don't forget to like
and subscribe
and share.
All right.
And leave comments.
Yeah, because we love to read them. All right, guys.
Love you.
Bye.
Bye.
Our life,
Our love.
our story.